Hello, my name is Patricia, and today I will be talking about the outcomes of a telerehabilitation pilot study for Hispanics. So the purpose of the study was to assess acceptability, determinants of health behavior change, and changes in pain-related outcomes in psychosocial mediators for a cognitive behavioral physical therapy telerehabilitation intervention adopted for Hispanics with chronic spine pain. Regarding the methods, 4 participants were purposely sampled from an urban health center. These participants completed a 7-week hybrid CBPT program, which focused on patient-centered goal setting and cognitive behavioral skills for pain self-management. Participants also completed assessments at baseline and 1 week post-intervention, where the primary outcomes and mediators were measured. And finally, all 4 participants completed semi-structured interviews 2 weeks post-intervention that were analyzed by 2 coders who used Rapid Qualitative Analysis to identify determinants of behavior change and explore participant perspectives. Regarding the results, for pain-related outcomes, all participants displayed clinically meaningful improvements in pain-related disability, which was measured through the pain interference on the brief pain inventory. And in this case, scores decreased from baseline by 2.7 to 6.5 points. For pain interference with physical function, this was measured through the patient-specific functional scale, which increased from baseline by 9 to 14%. Regarding psychosocial mediators, all participants displayed clinically meaningful improvements in fear avoidance beliefs around physical activity, which decreased by 3 to 14 points. Pain catastrophizing decreased by 3 to 32 points, and self-efficacy towards sticking to exercise increased by 0.6 to 4 points across all participants. For pain self-efficacy, this increased in 3 participants by 3 to 14 points. And we also conducted interviews with the 4 participants who are portrayed in these graphs. These interviews provided support for 6 determinants, which were therapeutic alliance, adherence, knowledge, self-efficacy, pain catastrophizing, and fear avoidance or fear of movement. And finally, participants reported improvements in dimensions of pain self-management, including communication, motivation, and awareness. And here I've included some quotes that demonstrate each of these dimensions, as well as the determinants of health behavior change. So as demonstrated by these results, clinical improvements in pain-related outcomes were similar or greater to comparable interventions in non-Hispanic populations, and a larger study to examine effectiveness of the adapted intervention among Hispanics with chronic spine pain is currently underway. And finally, I just wanted to give a quick acknowledgement to the San Diego State Health Sleep Center. Thank you.